This session is on informed consent, and just for my understanding, I would like to know how many of you are in ethics committees? Just a show of hands. Thank you. How many of you are researchers? Okay, good. So I am already speaking to an audience who is, the audience is aware of informed consent, but we will go through this. The first half will be about the informed consent, and the second half will be about the process of how you get informed consent. And we have people who have taught informed consent in workshops. We have people who are going to do research on different methods of informed consent. So we have a rich knowledge base here. So even after this, you would interact and get familiar with that. Now, what is informed consent? It's an autonomous authorization by a potential research participant regarding involvement in research. Now, as I go along, things will be explained. Now, what's the objective of getting informed consent? The research participant to have knowledge of the research to make an autonomous decision. This is the most important thing. And the other one is for the protection of the principal investigator. So the priority is for the research participant. Now, many a times there is a clash between the morality and the legality of getting an informed consent. Now, we need to keep in mind that the respect for the person is vital, and participants should be helped to understand. So we already know that sometimes we have elaborate consent forms with jargons, and these are incomprehensible. So we find that sometimes the emphasis is misplaced on getting the consent or the signature rather than in helping the participants to understand what the research is all about. Now, we have different types of informed consent. Individual consent could be written or verbal for individuals' own participation. Then you have the third party consent or the proxy, where parents, guardians give consent for minor children or for incompetent persons. And of course, we have the assent for persons below 18 years and those who are mentally challenged and so on, that they give their willingness to participate in the research. Now, readability factor is very important. As I heard this morning, you are already commenting that some of them are 22 pages long and not really readable or understandable. These are very ordinary things, but are very vital. Using a local lay language. What I mean is, Hindi is there in North India, but when you go to Bihar, it's mixed with Bhojpuri. So if you do translation in Hindi and take it there, they cannot understand. So that's what I mean by local lay language. And the level that is recommended is 8th standard level of language. And local terminologies, not textbook translation. Many a time when we give our informed consent for translation, somebody takes a dictionary or something and start translating, and the local people just cannot understand the terminology. And no medical jargons. Those of us who are in the medical field, the medical jargon is like an usual word to us. So we repetitively use that, and that particular important word is not understood when we try to get the informed consent. Short sentences and short paragraphs to describe what you want to say, and it should be translated by a non-medical person. And this is very important because as medics we have our bias of how we understand and translate things, and should be field tested with persons similar to the participants. Now, if we are going to do it among illiterate people, it should be among the illiterate people that we field test it, not giving into some paramedical staff in your hospital or somewhere like that. So this is very important. Now, of course, before you field test it, you will translate it into the local language, back translate it, give it to somebody else, not the same person who translated it, to see whether the concept or the idea is transmitted in the paper. It's not literal verbatim translation. It is the concept, the idea which has to be translated. Now, the contents. There are two parts. One is called the participant information or the plain language statement. The other one is the getting the consent form. Now, in the participant information, we need to see that all these things are, 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 are taking place in that particular informed consent. As you prepare your informed consent form, kindly keep this in mind. Name of the institution conducting the study is important. It's not some vague person from somewhere just coming into some hospital or community to do some study. Then the title of the study, and then a small description just below it to say the consent form, is it for patients or nurses or community people or whatever. Because simultaneously you may be doing a number of studies with number of informed consent forms in your hand. So this small thing will help you to differentiate. And sometimes the people take the wrong consent form, the team people, I mean the data collecting people or someone, can take a wrong information and take it to the wrong participants. So we need to be careful and mark it up. In the introduction of the informed consent, we need to invite the person to participate in the study. So we need to mention the names of investigators, names of institutions or departments doing the study, and if there is some collaborating institution, that should be mentioned. The next thing that we need to do is to define the study population. So who will be the study population, and explain why that particular person is an eligible person to be a participant. So that is helpful for the person to understand. The approximate number of participants, when you do a sample size, you will know, and you say, this study will be done in among 300 people, and you also fit into this criteria that we have to be a research participant, and we would like you to be. And we need to give some time to read the information given and to ask questions about anything they do not understand. Now we are assuming that the person is literate. So, but we also need to keep in mind, if they are illiterate, what we would do. These questions that they ask may be very simple, but we need to take time to explain to them, because that will remove fear, anxiety, and all sorts of unexpressed feelings, stress of not knowing what it means to be a research participant. And then after that is removed, they can make an informed decision of whether they would like to be in this research or not. The purpose of the study should be mentioned, what the study is designed to discover or establish. And the other thing is the technical part, the procedures, or what we need to inform. So in this we need to be careful. We need to tell the procedures chronologically, distinguish which procedures are experimental and which are standard treatments. Many times I find that people just take for granted and just don't explain the difference, and they just sometimes even don't tell that they're in a research. They just say, we will do like this, are you willing? But that can be in a clinical practice for any treatment or operation or whatever. But then if it is a research, it has to be clear. The participant should know that he or she is in the research. Explain medical and scientific terms in ordinary language. I'm telling this again and again, because even if you explain in ordinary language, there is research to prove that only about 22% of what is explained is understood by the people. So we need to be able to give some time and thought as to how we really explain these matters. Also, we need to explain what is expected from the participant. This involves the length of time for participation in each procedure, frequency of procedures. For example, if you want to take blood samples, so how often will you take? How much will you take? And for what are you taking it? For what will you use it? And where the blood sample will be taken? Is it in the village they are staying, or in a sub-center, or in your own hospital? And the total length of time for participation in the research. So it takes 6 months, or it's a short time, it's only for 4 weeks we'll be coming, whatever. The difficult thing to explain is randomization, I feel. And sometimes it is not easy in our situation to clearly say what is randomization, because many times we are the physicians or the health providers, and then we are the researcher. So there is a little bit of struggle for the person also, the participant, because usually in India the medical people make the decision of which treatment or which one is better. We are a little bit more paternalistic. So when you come to research, we tell them these are options, these will do, we'll do anything, one of these. So it's a bit confusing for them also. We need to keep this in mind. Potential risks and discomforts have to be disclosed. So disclose foreseeable physical risks, discomforts, inconveniences, and how these will be managed. Any psychological, social, legal, or financial risks that might result. And also we need to mention that it may involve risks that are currently unforeseeable. So that will help you. This is very important. Big cases go on because the risks were not informed, even in clinical practice. And then there's a lot of compensation to be paid. So we need to take that extra time to explain the risks known and probably unknown. So that we tell them, don't dismiss. If you feel something else or something else is happening, please inform us. So they know that there is freedom to express. Anticipated benefits. Many of the participants ask, what do I get from this? So we need to be clear. Describe the potential benefits to subjects or to patients similar to the subjects, or that participation will not directly benefit them. So if we are clear and we are saying it's adding knowledge to the science, then it is fine. State the anticipated benefits, if any, to science or society expected from the research. So these are some of the stuff. Payment for participation. This is always a sticky issue. State what participant will be paid. If there is no participants, state so. Or you just say, this is a study like this does not have any payment. If they ask, that is necessary. If you are paying, then mention remuneration amount and when payment is scheduled, so that they don't keep on anticipating and pestering you. It will be at different times. Any reimbursement for expenses such as travel or whatever, their food or whatever it is. So that you need to make a list for clarity from yourself. Even when you make a budget, this will help you. So the list of payment rates of how much will be paid. Subjects should not lose payment if they develop side effects or illness. You can't punish them by cutting off their payment. Then in situations in genetic research and other stuff, if any human materials are used which may in the future be of commercial value, the subject must be informed of the fact in the consent form. Now later on we will see when and where we are going to disclose all these stuff, but these we need to keep in mind, because some people feel that it should be a one-time blanket consent, others feel it should be progressive. Privacy and confidentiality also is necessary. Confidentiality of one's participation, it should be mentioned in the informed consent form, how you will respect them and maintain their dignity by not disclosing, because some research is more sensitive than the other, and so we need to be careful. So confidentiality of one's participation, personal information, and the research data, whatever you are getting out of them. So these three things need careful consideration. Storage of data is another important thing. As you know, we need to code these things and they should be stored, protected. Once you store it, doesn't mean that it is foolproof. There are instances when people try to take data, so we need to be careful. It should be password protected, and only a limited number of authorized persons should have the access to this data. That's very important. When you also need to disclose when individual data will be destroyed following analysis, format in which the data will be reported. For example, whatever I learned from this will be in a form of a paper published in a journal, or I will be presenting it in research circles, something like that. Also, we need to be clear on how specific consent will be solicited. Participation and withdrawal, this is an important thing we need to write. As we know, with all the Tuskegee problems and things, that now we have gone to the other extreme of saying that participation is completely voluntary. One can withdraw from the study at any time, though we don't want them to withdraw. It should be made clear, and no penalty or consequences of any kind will be laid upon them, and decision not to participate will not affect one's relationship with the institution or other services to which one is otherwise entitled. If they are entitled to some services in your institution, those privileges should not be deprived if they opt to discontinue or they don't want to be a participant. Now, there are instances when the investigator will need to withdraw a participant from the research. Now, these also you need to write it down and keep it, following the side effects whatever listed. These are known side effects or things which can happen as a result of your intervention. Then in the case of severe illness, or the investigator will make the decision, not the participant on these grounds. So, it is in your hands. Withdrawal is from the person, but here to stop further being a participant, the investigator will make the decision. And the whole idea is that we need to protect the participants' health and safety. Sometimes in vulnerable populations, people are more tolerant and say, it's okay, I will bear with it, I will continue to be. And they may be happy to be a part of your research or get compensation or whatever. But then the investigator takes the initiative to make the decision. Emergency care and compensation for injury. Now, we need to keep this in mind. In the unlikely event of physical injury resulting from participation in this research, you may receive medical treatment from. We should give them some institution's name or hospital or counselor or whoever, and including in emergency treatment and follow-up care that is needed for that person. Now, I heard about this research that they want to do among elderly people with depression. Now, if you just stir up all their reasons for depression and everything, and they go into a suicidal tendency, now what are you going to do? So, there should be some mechanism of planning for the backup, so that they don't go and commit suicide. At least they were living and depressed. Now they will stop living if they go and commit suicide. So, we need to keep this in mind. And any compensation for injury, of course, has to be worked out well in advance. The contact details of investigators are important. Names and phone numbers of principal investigator, co-investigator, the institute or the contact person. Suppose it's a multi-centric research, you will need to tailor make it to each center, and emergency or night phone number, so that you are contacted promptly if required. These are some of the things. Now, as you write all this in the participant information sheet, we need to give time for them to listen to it or read it, understand it, ask questions, and after that they would sign the consent form, which states, I have read the information provided above, I have been given an opportunity to ask questions, all my questions have been answered to my satisfaction, I have been given a copy of this form, I willingly agree to participate in the research, and then they put their signature. Now, signatures is by the research staff to state that she has explained the research. Now, when you say it's the persons who are going to implement the team, the research team, the designated person will have to do this. And then the participant, willingness to participate. So, that is why they put the signature. And then if it is an oral consent, then we need a witness to state that the participant signed the consent form. It is for identification. We need to have that. Now, this consent form ideally should be signed in duplicate, and one copy would be with the participant and one copy will be with the investigator. So, that is the end of the session. Yes, please.
Just a clarification about my study design. The thing is that, I deliberated on the flip chart, the use of audiovisual. I haven't really come up with one thing because I need to know the feasibility of the method as well. The first thing you talked about, the process of contact. I mean, most of the informed consent forms actually list the PI, the name of the PI as a person to be contacted. But my question is, given the fact about our country especially, where doctors are always considered superior than a normal lay person, I mean, if I give contact of a PI for the person to come and ask the question or whatever, don't you think that it can reduce the the patient's questioning power, simply because the fact that the person he or she needs to talk is a doctor? Is it possible that we can give it to a person, a lay person, or someone like another member of a research team which is more closer? I mean, the person feels more confident.
Now, there are two things in that. You have rightly pointed out the power struggle there, and so the person may not contact you. And of course, all the time PI cannot be attending to all these phone calls. So there will be another set of contact person for your research who will be mostly available in that locality, given the circumstances. PI may be going here and there and lecturing, whatever. That is another thing. But in some places what happens is that person who's collecting the data, whom you have given as a contact person because he's in that locality, it's may be doing something wrong. And in that case, it may not be even related to this research. Suppose he is indulging in some premarital affair with somebody or something. There's no point giving that particular thing. So in case they have something like that also, you need to have some mechanism of who will attend to it. That is the idea. And some places in international thing, they give the the secretary of the committee, ethics committee secretary's phone number will be there.
Most of the persons we list are either researchers, doctors in that level, which sometimes, I mean, this is very good in terms of Western concept. That's what I felt, because in Western concept, patients do ask questions to doctor. They know about their rights and autonomy and all that. But in our context, when we even do not know what our rights are as a patient.
Now it is changing. India also is changing, I feel, and there are a number of patients who do a lot of web search and come and sit in your OPD, and you may have to say, I will tell you next time. Okay? So it depends on your patient, participant, whoever. And so, but always treating them like that also is, we are also then keeping them like that. So give them the liberty, it will keep us also on our toes in case something happens or something. We need to be careful. And in foreign countries, these phones and these things work very well. And there are, suppose you are on leave or something, there is automatically somebody else taking. We don't have such covering facilities and we don't inform everything. So I feel we need to keep one or two layers of this. Yes.
Ma'am, one more question about the same thing about the process. You talked about data, like we need to inform how long the data will be kept after post-analysis to when the data will be destroyed and how we are going to disseminate the information. But the question is, a lot of times it's very difficult as a researcher to know, I mean, in terms of publication, if I'm sending a paper for publication, I'm really not sure how long the publication process is going to take. And a lot of journals actually require me to keep the data for review or whatever. So is it possible for me to identify it a priori? And another second thing is, we might not have the desired outcome, and then I'm thinking in terms of writing it up as a paper, but I might actually end up, just presenting it in a conference because my data might not, I might not get the desired result. So how do we get over that?
Two things. One is, if it is a video or an audio recording of the focus group discussion, you'll say it will be transcribed, it will be translated, and it will be tested. And when that is done, I destroy that. That destroy means I erase that. That's fine. That's one thing. Second thing is, certain institutions have their own stipulations for different types of research, how long they will keep. So you say usually this will be kept for so long until it's required, or of a minimum period of this much, or a maximum of that much. Okay, so you can use different words, not that on this date it will be all washed out, but something so that is good for you also, good for them also.
You talked about maintaining a relationship between the dyad of researcher and the study participant, and there the importance of keeping things very transparent, and that's basically the objective of the informed consent. But there are a few issues that I just was a little concerned, was that how much are we giving an opportunity to the participant to be involved in the whole discussion? If they have any clarifications, if they have any questions, where do we give them? By giving them the opportunity, okay, they are going to talk to the PI, because it becomes the same group of people who are involved in the research. The name of the chairperson, who is a third party person, in fact, That's important in a consent form, and that's what we are doing at our institute, which is NARI, the National AIDS Research Institute. So we give the name of the chairperson along with the investigators and also the collaborators, so that this is the third person that whom the person would really like to contact whenever they are in a process of discussion. Now the other question that we also always work around is the topic was about compensation. You know, when the moment we are not giving you any compensation or we are giving a compensation. I think this issue is not a part of the consent process. That's what our ethical committees really feel is, because here we are all asking is the consent based on their participation. The compensation is a part of something that is a part of the process that they have come, we are giving it. Because that is not an inducement or anything that is there a part of a compensation. Or we are not giving them anything. I mean, do they really be a part of it? So that was a little clarification.
Part of what?
Do we put it in the informed consent that we are not giving you any kind of a payment, or we are giving you a payment? Because then the moment we put it as that, it really amounts that we are luring them into participation. You know, whatever we will work out, whether it is a compensation for their wages, whether it is a transport thing or whatever, the moment we put that, because the decision has to be taken regardless of this amount, you know, whether it is payment or not payment.
No, I mean,
so that is the way we have always debated, and our the advice of the ethics chairperson is always, and the ethics committee is that if we write that really is not amounting to, because there are studies where they would say no money is involved. We don't even write that part, that we are not giving you. We don't even say that we are giving you, because this is a separate issue altogether. The consent is really an understanding between the dyad of the researcher and the participants. So I would like you to comment on
does
that.
anybody want to comment on that? Yes, sir. Yes, sir.
It's a very interesting question. I'm going into the details of the mechanism of taking consent. You know, the compensation and protection, what is to be provided as a part of information to the participants is a must. First thing is that the document is to be approved by the ethics committee before it is, and it is final. So you can't discuss anything outside the scope of the document approved by the ethics committee. So the question of what compensation would be paid, not paid, cannot be left outside the realm of the consent. So it has to be included within the consent form itself. And it has to be documented that whether or not there is any inducement. So a reasonable return, a reasonable I would say coverage which is being offered, it's not an inducement. That itself shows that there is no inducement. So it can't be left out of the process of the document of information to the participant. It should be part and parcel of it.
Thank you, sir.